Planned Parenthood is again offering abortion services in Wisconsin in more than a year after the U.S. Supreme Court overturned Roe v. Wade.
Providers initially stopped offering abortions out of a fear that a state law from 1849, which may have banned the procedure, it was unclear that it might be enforced. But a judge ruled last month that the law does not apply to medical abortions. When we spoke with representatives from Planned Parenthood last year, on the day that Roe was reversed, they gave us insight into the difficulties navigating this law.
One of the problems with that law, it is so vague, right? And it's a very short law when you look at it. And so basically, it criminalizes a person who would provide an abortion, other than that, to save the life of the mother. And it doesn't really define what save the life of the mother means.
Joining us now is the president and CEO of Planned Parenthood Wisconsin, Tanya Atkinson. Tanya, I remember being there with your staff, with all of you there at Planned Parenthood Wisconsin on the morning that the Supreme Court decided that Roe versus Wade was going to be overturned, and the response that all of you had in that uncertainty about what that was going to mean for the clients that you served. What has the response been like to the resumption of your services in the state?
Thank you so much for reaching out to us. And that was a very difficult day that you were with us. And when we announced last week that we were resuming services, the response has been overwhelming. First and foremost, with regard to our patients, when we opened the appointments within 24 hours, the appointments were filled for both of our health centers. And so it really underscores that the need is there. This is essential health care, and that it was critical that we resume providing services as soon as we possibly could.
And Tanya, how has your organization had to adjust over the last 15 months? Talk to us about how you've continued to serve people, patients over this time. What changes have taken place?
Yeah, thank you for that question. When, as we were preparing for the overturn of Roe, certainly the leak, made it clear what was going to happen. We added patient navigators, which was really critical. So people in Wisconsin who needed an abortion could still call Planned Parenthood of Wisconsin. They could make an appointment with one of the navigators, and those navigators could help people, get to a state where abortion was safe and legal. They could help provide some resources as necessary. So they were a critical resource. And our teams could also provide some pre-care and certainly aftercare for when people returned home. And I would also add that our teams were traveling to Illinois and working with our incredible partners at Planned Parenthood of Illinois, providing care to, of course, women and people across the gender spectrum from Wisconsin, and also people across the country, because we know how tenuous access is across our entire nation. And so, staff were seeing people from across the country in Illinois.
Tanya, I remember on the day that Roe was overturned that your staff was calling people in advance, trying to tell them not to come for appointments, to try and avoid the spectacle of being there as protesters were in your parking lot. And yet there was still a couple that arrived there and turned around. The law that challenged you is from 1849. That was a law that's on the books in Wisconsin. Before, we should know, women even had the right to vote in this country. What challenges have you been through in this time period? What challenges do you still face as you try to serve the people of Wisconsin?
Yeah, so certainly that 1849 law, and Wisconsin became a state in 1848. So the 1849 law, the lack of clarity was obviously the reason that we had to very unfortunately suspend services. And, during this period of time, it's been devastating. It's been devastating for the people of Wisconsin to, have to travel out of state, if they can even do that. The barriers that were presented by being forced to suspend services for some people were insurmountable. And we know that some people weren't able to access care out of state We know that some people were asked to travel in, healthcare situations that perhaps they should not have been traveling in. And, and it's been, very, very upsetting for the state. And we also know there's medical students that were planning on coming to medical schools in Wisconsin that opted not to, and people who are already in medical schools who, were looking at leaving. And in a state where we're challenged for OBGYN access statewide, and particularly in rural areas, that impacts the state health overall. So it's been a challenging year and few months in Wisconsin. And the second part of your question is really important because while it's clear we can resume providing abortion services, we have to provide services under the existing restrictions. And Wisconsin has some of the longest lists of abortion restrictions in the country.
Yeah.
Tanya Atkinson, thank you so much for joining us today.
Thank you, Tanya.
Thank you.